What drug causes dilated cardiomyopathy? It's daunorubicin and doxorubicin causes dilated cardio. The other drug that cause cardiomyopathy, dilated cardiomyopathy, are imatinib. It slow the disease process and increase the longevity. Why we use anticoagulant in dilated cardiomyopathy? Because of atrial fibrillation. Atrial fibrillation occurs in all the three types of cardiomyopathy. What is the cause of hypertrophic cardiomyopathy? It is due to a defect in gene protein mutation in sarcomeric genes. What about the septum in hypertrophic cardiomyopathy? There is irregular hypertrophy of the septum. What are the other conditions that causes hypertrophy of the septum? That is aortic stenosis and hypertension. So these three conditions, there is a bispherians pulse in the hypertrophic cardiomyopathy, whereas in aortic stenosis, it's a pulsus parvus. What condition causes sudden death in athletes and youngs with a familial history? It is the hypertrophic cardiomyopathy that causes sudden death in athletes and youngs. What one advice is given to the patient with hypertrophic cardiomyopathy? Avoid strenuous exercise. What other condition in which we advise to avoid strenuous exercise? It is aortic stenosis. So these two conditions, hypertrophic cardiomyopathy and aortic stenosis, we advise to avoid strenuous exercise. How about the murmur positional change, effect of positional change on the murmur of hypertrophic cardiomyopathy? Usually the most murmur decrease on standing and on Valsalva maneuver. But these are the two conditions, hypertrophic cardiomyopathy and mitral valve prolapse, where the murmur increases on standing and on Valsalva maneuver. What is the finding in